focus more on palliative care, how we should provide care, and what is the role of primary care physicians in during this COVID-19 pandemic. So to start with, we know presently we are facing the globally the coronavirus disease pandemic, and it has caused lot of mobility and mortality worldwide. And we know most patients with COVID-19 are either asymptomatic or having mild symptoms, but mortality is highest in vulnerable groups. So one of the vulnerable group is who are suffering from non-communicable disease, that includes the cancer also, and also the palliative care, palliative patients also vulnerable group. That's why we want to organize this session, like how to provide care for the cancer and including palliative care, palliative patients during this COVID-19 pandemic. So to start with, you must be knowing what is palliative care, but to refresh your knowledge, I just give the broad definition that is given by the WHO. We know that palliative care is we provide the care for the patients who have life-threatening illness to prevention and relief of suffering by means of early detection and proper assessment and treatment of not only physical symptoms and including psychosocial and spiritual care also. And here, like, our main aim is to improve their quality of life. And in the palliative care, we include not only the patient, we have to look after their caregivers and families. So it is a holistic care we are providing for the palliative patients. So in other words, like when we take the palliative care, it covers many aspects. So not only the managing physical symptoms of these patients, but we have to focus on psychosocial and social issues, spiritual care, and look after them with the cultural and ethical, it should be aligned with their cultural and ethical backgrounds, and also we have to take care of the legal issues of these patients also. And when we talk about the palliative patient, it is a spectrum of patients. Not we can't group them into one group, because it's we generally call it as a palliative care, but it has sub components like end of life care we have to provide, and also terminal care. So all these aspects are relevant to this pandemic season. And other than the normal spectrum of palliative patients, during this season we come across new type of patients also. As primary care physicians, you have to provide care for the already registered palliative patients, and you might come across new palliative patients, and also palliative patients with COVID-19, and sometimes you will come across terminal patient because of COVID-19. So for all these patients, you have a role as a primary care physician. So when we talk about the palliative care, it's the care is provided by a multidisciplinary team. That team includes health, non-health professionals, as well as the volunteers. So in this team, one of the main characteristics is the primary care physician, because he links the patient who is in the community with the treatment center. So he plays a very important role in palliative care provision. So what are the challenges providing care during this season as a primary care physician? So in your care provision, you will come across a patient, palliative patient, not known to have COVID-19. So you have to provide care for them. And as a healthcare provider, so you also faces many challenges during this situation, because you might working in a resource limiting setup. So you have to, and it's like a disease. The pandemic is going on, so you have to adjust your services also according to the current situation. So if you come across a patient not known to have COVID-19, a palliative patient, you have to provide a spectrum of care for the patient. So sometimes you may need to involving symptom management of this patient, and also sometimes you have to ensure continuous supply of drugs, because sometimes they have problems of getting their usual drugs such as morphine. So you might need to involve arranging these supplies. So you have to link with their treatment hospitals, and you have a role in this area also. And sometimes you might come across the palliative emergencies, so you might need to attend those. And a very important aspect is, as I mentioned earlier, palliative care is not only managing physical symptoms, it has other components also. So looking after mental health of the patient is very important. So when you come across patient, so always spare a few minutes to communicate with the patient and support their mental well-being, and help to alleviate any anxiety or fear they might have having about COVID-19. It is also important aspect of palliative care. And apart from managing physical symptoms, we have to look after their nutrition and hydration. Those things also important. So not only managing health problems as primary care physicians, you might have to attend his other problems like social care, social issues. Sometimes because this patient get services not only from the health sector, non-health sectors also involving to give care, like social service departments, and sometimes they get financial assistance likewise. So if there are any problems are encountered, so you might have to link with those authorities and support the patient to make it going on. So that also one of our as a primary care physician. So not only looking after these patients, I mentioned earlier in our definition also the caregivers also an important aspect in providing palliative care services. So in this current pandemic situation, the empowering caregivers, because most of these patients are in the community, because they are not on active treatment, so they are just only follow up in the community. So more like the care is given mainly by the caregivers or the family members. So as primary care physicians, we have a role to empower the family members, like on danger signs and about this nutrition, symptom management, or looking after the mental health. So we have to address that aspect also. And one aspect is they are vulnerable in this situation. So the deaths may be common among them. So we have to prepare to give the bereavement support for the surviving family members. That also one aspect of the primary care physician, their role. And all those components are relevant to the patient, the palliative patients who are not having COVID-19. But if you come across a patient with known or suspected COVID-19, so we are not in a position to provide care in the primary care level. So we have guidelines published by the Ministry of Health. So we have to work according to that and do the necessary arrangements, transport or transfer, everything. We have to follow the Ministry of Health guidelines. So another aspect is in this situation, we have to prevent cross infections. There is a risk of COVID-19 risk to the healthcare worker and the COVID-19 from patient to the healthcare worker and the other way around. So we have to minimize the cost. So then we have to organize our services, we may have to deviate from the normal routine. So one is we have to minimize face-to-face contacts and minimize unnecessary consultations. So one aspect we have to consider is we have to organize our appointments. We have to minimize the waiting time of the patient in our setting, so that so we can arrange the appointment system, and also we can use alternative methods for the consultations, the telephone or video consultation. We can use a tele consultation method, and to minimize a patient coming to our institution, we can always support them to arrange their other services medicine. So if we can arrange home delivery services for medicine, so always we have to provide that. And as I mentioned earlier, in the current situation, healthcare workers also under stress, because his normal setting has deviated from the usual pattern, and also they have to work with limited resources, and his lifestyle also been affected due to the COVID-19 pandemic. So the one important aspect is we have to look after ourselves also. So the burnout, fatigue may be common among the primary care physicians. So always we have to think about our health also. So if we think we need some support, always look for it. And as primary care physician, I mentioned earlier, there is an important role in empowering the family members and the caregivers, because these palliative patients, they are not on active treatment. They are in the community at their home, and mostly follow-up arrangements only they are having. So the one of the key goal of us is, as primary care physician, we have to empower. So we always give the key messages, how to look after the patient in the community to the caregivers. So one important area is maintain social distance. So to prevent or reduce the transfer of the patient across homes, and advise them to avoid overcrowded places such as religious places, markets, and restrict visitors, friends to the home, and avoid unnecessary gathering, avoid contact with the patient, with people who are sick in the household, and if possible, keep a patient in a separate clean room or in a physical separable space. And also educate them on the good hygienic practices. Arrange hand washing facilities at the entrance of the house, arrange hand washing facilities at the entrance patient room, and patient must wear a protective face mask in the presence of others, caregiver, and all others must wear a mask when attending the patient. All these things we have to educate when we come across the caregivers during our services. And other aspect is both the caregiver and the patient have to maintain good hygienic practices, frequent hand washing, wash your hands before and after caring the patient, avoid touching, always maintain 1 meter distance unless it is necessary for caretaking. And protective measures must be taken while coping and squeezing.
Madam, can I interfere for a moment? One thing is that we have only about 10.
Sorry?
About 10 minutes.
Okay.
10 minutes more. And the other thing is this for all the participants, if this expires, just connect with the same link.
Okay.
Okay. Thank you.
Okay. So the nutrition hydration, regarding nutrition hydration also, we have to educate them and look after in the mental well-being of the patient, and always maintain cleanliness. Like if the patient is using wheelchair or other appliance, must be cleaned with disinfectant. And another important aspect is when we getting respite care, that is when we get the services of temporary caretaker, always like we have to follow the national guidelines, because we know some some areas locked down and time to time, so all these things we have to consider. And the National Cancer Control Program already has developed fact sheets for the caregivers, how to provide care for the palliative patient at the community. So you can download these soft copies from our website and you can disseminate among your clients. And also that is for the palliative patient. For the cancer patients also, we have developed fact sheet for the caregivers, how to look after the cancer patient in the community. This is also available in our website. And not focusing the COVID-19 pandemic, our NCCP has developed the Diviyata Sanasuma, that is the awareness booklet for the caregiver of an adult cancer patient, including palliative care. So that also available, and we are distributed to the patient through the cancer treatment centers. So whenever you have a palliative patient, please see these booklets are having with them. And also to empower the community, we have developed leaflet about the palliative services available in Sri Lanka. So you can also use these for your patient and caregiver awareness. That is for the childhood cancer caregiver awareness. It's a booklet developed by the NCCP, and we are distributing it to the Apeksha Hospital. And as the time is up, because I want to stress another important thing. Palliative care we provide at the hospital level and the community level. Community level, one important setting is the hospices. That is provide residential care for the palliative patients. So in Sri Lanka, all the hospices, there are 7 hospices governed by non-governmental organization throughout the country. So when you are looking after a patient, you can get the services from these hospices also. So this is our website. So if you have any question, you can email to us, or you can ask it at the end of our program. So I will hand over to the Dr. Tusita to continue the program as the time is limited. Thank you.